The recent Ebola outbreak in West Africa drove controversy and ethical dilemmas in nursing care in our society. Many of these ethical challenges have been faced with the utilization of ethical principles and the use of the ANA Code of Ethics during this emergency response situation. As the recent Ebola outbreak and global responses continue to progress, many concerns are brought up for research. Kiltzman discusses the many possible treatments to Ebola provided through many research studies. Kiltzman states favipiravir was found to decrease death rates from 30 to 15% among patients with low to medium viral levels, leading to calls to use this drug more widely, to administer it instead of placebos in other studies, and to roll it out more broadly in the population as a whole. This, however, has brought up misconceptions that there is a treatment for Ebola for those in other studies receiving other treatments, and in fact, throughout some of these studies, participants felt they were 100% going to be covered. This brings up a very serious health-related ethical dilemma. Kiltzman discusses how affected populations view and understand the possible treatments and vaccines for Ebola under research study as a therapeutic misconception by feeling they are protected for the virus. Kiltzman states preventative misconceptions has been described whereby participants in a disease prevention study overestimate the likelihood that they will receive personal protection from the study. As we learned, participants should be fully aware of the outcomes, the benefits versus burdens of the study before signing consent. That is our ethical duty under research, thus violating a do no harm situation of non-maleficence, related to the fact that the participant felt as though they will be treated from Ebola, which is falsified information. This also causes physical harm in families if they also have a misconception to this Ebola treatment, putting their own lives at risk. Any study related to interventions against Ebola need to be conducted as ethically as possible, and as nurses we must provide care no matter the environment as ethically as possible. This is when we can refer to the principles of ethics. We must respect individuals' autonomy by assuring participants understand that a cure is not guaranteed prior to signing informed consent. Promote beneficence by assuring these patients receive treatment if an effective treatment arises. Promote non-maleficence, as previously discussed, and social justice to assure affected populations receive possible effective treatment. Another impact Ebola has on our nursing profession is the isolation factor to these patients infected, or those who live near high-risk populations. Sylvia Smith states that the isolation for Ebola will likely require renewed consideration of ethical justifications and legitimate conditions for isolation and other restrictive measures, which ultimately limit certain human rights. To assist in the decision-making throughout ethical research dilemmas related to Ebola, we can utilize the 6-step process of ethical decision-making. To address the issue of misconception related to treatment, I will gather the information and statistics by finding out the most affected population of misconception, identifying that this is an ethical dilemma harming beneficence, and explore possible alternatives to assist with this concern. An alternative can be contacting the Bioethics Commission for assistance. Lee 2015 states, the Bioethics Commission engages in public bioethics using democratic deliberation, assists with ethical concerns related to the Ebola crisis. Then I can evaluate the process and outcome to assure that further studies remain ethical and those who are studied with ineffective treatment will receive treatment if an effective treatment arises. We can apply these ethical dilemmas related to Ebola with the ANA Code of Ethics. Shannon 2015 states, we live in a society where systematic injustices exist and factors such as race, ethnicity, gender, disability, and socioeconomic status. Provision A in the ANA Code of Ethics enforces health is a universal right. Ethically, ethnicity and socioeconomic status does not matter. We can also apply Provision 3 in the ANA Code of Ethics when emergency planning is needed during the increase in exposure to the virus. Shannon discusses facts regarding promoting a culture of safety, adhering to the ANA Code of Ethics Provision 3 by integrating ethics into public health emergency planning responses aids anticipating, identifying, and addressing ethical concerns in the early stages of emergencies. The American Nurses Association defines Provision 1 as respect for human dignity, related to human rights, and value the changes in public and health policies to support this. No matter what population is affected, we must always keep respect of human dignity intact. Further research is needed to obtain definite answer to these treatments for Ebola. To break the misconception of treating Ebola to the public, it is imperative patients and the public understand the results of any Ebola vaccine study, because misunderstandings can further contribute to fear and mistrust.